Hi, everyone. Welcome. We'll give everyone a second to join. Thanks, everyone, for being here. I know there's a lot going on with the holidays coming up, and I hear there's a big storm brewing in your area. So I hope everyone is staying safe. And thank you for taking the time to be here today for our Northeast CPI session 11. Hard to believe that we're this far along in 2024. Next slide, please. So just a reminder that we are recording this session. It'll be made available after the session, and we'll share that out with you. Next slide. Please, everyone, update your Zoom name to include the name of your organization. We would love to start with a chat icebreaker. If everyone could put the name of your favorite TV show of all time in the chat. Looking forward to seeing some of those answers. And as always, we are looking forward to a dynamic session, so please feel free to use the chat, raise your hand, come off mute. This is really your time, so we'd love to hear from you. And let's see, we've got The Office, Doctor Who, Gossip Girl. It's a good variety. Rules of Engagement, Ghost Whisperer. Yeah, these are good. I also need some rec, so I appreciate all of these. Thanks everyone for responding. Next slide, please. And is there anyone new to the collaborative? If so, thank you for joining us. We're really excited to have you here. There is a link in the chat to all of our previous session materials, so you can access those. But I'll just take a second. If you're new, please feel free to just come off mute, say hello, or in the chat as well if that's better for you. Any new folks? All right, maybe not. Next slide, please. So our objectives today. Hey, Janet, thanks for joining us. Our objectives for today, by the end of the session, participants will receive important updates and resources pertaining to funding opportunities, the justice-involved population of focus, and hospital engagement. Participants will also receive important updates and resources from Partnership Health Plan. We have Brittany joining us today. Thank you so much for being here. Really looking forward to that presentation. And then also we'll have a chance to review and discuss an asset map of enhanced care management providers in the Northeast and brainstorm next steps on how best to use this information and move forward.
Yeah, thank you.
Next slide, please. So just to give you a sense of today's agenda, after we finish going over the level setting, we'll focus on our updates and resources. We will have our updates from partnership. We'll go over our ECM asset mapping section and then leave you with some next steps. All right, so moving on to important resources and updates. We wanted to remind you all that on January 6th, the cited round 4 application will be released. The deadline to apply for cited round 4 is on March 7th, 2025. The PATH cited website is linked there. But we've also received information about the priorities for cited round 4, and so wanted to offer these to you. The priorities include the following: ECM and community supports in rural communities, statewide ECM needs, tribal partners and providers, statewide community supports services needs, county-specific gaps in ECM by population of focus, county-specific gaps in community supports services by community support type, and counties providing transitional rent. So please keep that in mind. And then also you can contact the cited team directly with any application related questions. Next slide, please. So we wanted to give you an idea of what this timeline is going to look like between now and when applications are due. So on December 20th of this year, we will be hosting a cited round 4 learning lab, which will cover topics like historic eligibility criteria. There'll be an application walkthrough. We'll go over types of projects that are eligible for funding, how to build a strong budget and common denial reasons. So these are some topics that might be included in that session. And then on January 6th, as I mentioned, DHCS will open the cited round 4 application window. You can contact with them any questions, like I mentioned. And then between January and February, we will be available to provide any additional support that's needed with the cited application. And we'll host a final walkthrough during the February in-person session to address any remaining questions prior to submissions. And then, as we mentioned before, the deadline to apply for cited round 4 is on March 7th, 2025. And just a reminder that cited funds can be used for things like upfront funds to build capacity, IT infrastructure, workforce, evaluation and monitoring, outreach, and other DHCS approved uses. So we are really here to support you throughout this process, and we really hope that you'll consider applying for cited round 4. Next slide, please. And I'll pass it over to Gretchen.
Thanks, Ava. Hi, everybody. Hope you're having a good week so far, and I hope the storm's not going to be too bad. So just wanted to raise this up again, the Justice Involved initiative. We've talked about this a little bit before, but California is the first state in the nation that's going to allow some Medi-Cal enrollment and some certain Medi-Cal services to be provided up to 90 days pre-release. Very exciting. 3 counties in the state have started to do this work. I know it's going to be a challenge to get all the IT systems set up, all the workflows set up, so it's going to be a big lift. But we did want to raise this up. We do know that Siskiyou has put in their application to launch the Sheriff's Department pre-release services at the end of January. So if you are providing services in Siskiyou, you can be aware of some of these resources that we have here. There's a fact sheet that's linked here. But one of the big things I wanted to highlight was this webinar series the state has put out over the past several months about the justice involved population. And they have very specific topics they cover. One was around behavioral health linkages, which will be very important for the reentry planning. And then the November session was actually on ECM for the justice involved. It's not quite put up on the website yet, but it should be up in the next week or so. But some really good information as we start to see this come alive in more counties across the state. And it's good to see what's happening. And of course, as we learn more from other counties, we can bring that back to you all. Any questions on JI?
Can I, hi, this is Amber. Can I just share something real quick?
Please.
So we got the partnership grant to like focus in on justice involved. So we've been starting it and we've been attending their training series. It's super good, like
Great.
Very helpful, very relevant information. So I would encourage folks like, I think they've done a really nice job with it. So I just wanted to pass that along because sometimes a long training series, you're like, meh, but it's really good.
Thank you for that enthusiasm. All right, I'll turn it back over to you, Ava.
Thanks, Gretchen and Amber. Next slide, please. So we also wanted to let you all know about a DHCS public webinar on December 6th. That will be on hospital engagement in CalAIM, supporting connection to ECM services among eligible Medi-Cal members. And that link is also there, and we'll drop it in the chat in just a moment. Next slide, please.
So far.
So now we would love to turn it over to you and see if any of you have any updates or spotlights you'd like to share with the other stakeholders in this room.
This is Chris at Dignity Health Connected Living. I just wanted to share that we have successfully placed CHWs actually up in Siskiyou County and down in Tehama counties now. So we've been really expanding our services and building very quickly. And the hospital integration work that we've been doing has been really successful as well. So just giving a shout out to my team and Amanda Diaz, the supervisor, who's been really leading the charge on that.
That's great. Thank you so much for sharing. Congratulations. Any other updates or success stories anyone wants to share with the group? Thanks, Christina. We also wanted to highlight here the CPI success stories that DHCS has been compiling. We really want to uplift this just as an opportunity to celebrate the amazing work that all of the CPI providers are doing. But we'd also just love to hear about your work and your success stories if this is something that you're interested in sharing. Please always feel free to reach out to us, and we'd love to elevate this and just share all of the impactful work that's happening. But thank you for sharing. Next slide, please. All right, so now I will pass it over to Brittany from Partnership to walk us through some updates.
Thank you, Eva. You can go to the first slide, please. All right, so hi everybody, my name is Brittany Johnson. I am one of the program managers with Partnerships Enhanced Health Services Department. So it's nice to be here, and I'm just going to provide you with some partnership updates. So next slide, please. All right, so just a quick glance at what we'll be going over. So we're going to give a few TAR updates regarding turnaround times. We have some exciting news regarding our provider portal and TAR indicator. We have some DHCS updates, as well as an overview of partnerships, CS and ECM provider oversight. Next slide, please. Amazing. So we are very pleased to share that all of our CS and ECM TARs are within the 5 business day turnaround time, which is very exciting. If you do need any assistance regarding TAR submissions, or you do have one that is pending that you believe is outside of that 5-day range, please reach out to the ECM or Community Supports Help Desk, and we will absolutely assist you as quickly as possible. Next slide, please. All right, and so again, we are very excited to announce that the ECM and CS indicator, which is now available on your provider portal as of November 15th. So this is a tool for our providers to determine if a member is already assigned to an ECM provider and is working with, is working with another CS provider. So again, this indicator is present in our partnership provider portal for everyone to be able to access. And what we are hoping is that this is going to help prevent any members being dually enrolled or attempted to be enrolled with multiple providers at the same time. All right, next slide. Okay, and just a few DHCS updates. I know some of you may recall the closed loop referral discussion that kind of came to be this year. So that reporting requirement from DHCS has been delayed until July 1st at this time, and obviously more updates to come for that. And we are still pending final guidance from the state on the transitional rent service as DHCS is still reviewing all of the feedback. So we will provide updates when we have those. We are also awaiting the finalized updated ECM and CS policy guides. And DHCS has shared that there will be an oversight and monitoring in 2025 for not only the managed care plans, but also our ECM and CS providers. So as of today, nothing has been shared, but we are going to go over that a little bit in the next slides. Perfect. Thank you. So just real quick, so partnership has a responsibility as a managed care plan to have an ECM and CS provider oversight and quality program. So in Q1 of 2025, we will be launching a more robust program. ECM providers are familiar with our care plan reviews as of now, but however, in the new year with the enhanced oversight program, we will be seeking records and documentation for both ECM and CS providers. And you can actually stay on this slide for just a second, sorry. And so again, these reviews will start in Q1 of 2025, most likely towards the end of January. And so just a little detail. So we will select 15 ECM providers and 10 CS providers. Providers will be grouped by type, large, medium, and small, based on the amount of enrollees for ECM and folks that are being served for CS. So partnership will randomly select 8 member files to review initially. If the provider scores a 0 out of the initial 8, we will pull 8 additional members. We will also review TAR records, as well as ROIs, care plans, etc. The passing score is 80%, and anything below will result in a corrective action plan or CAP. And we will briefly, and I will go over that next. So again, so providers will be contacted with a letter 30 days before, indicating that they have been selected. The review tool and scorecard will be shared with each provider that was selected, and that is going to outline the audit process and scoring. And all oversight materials will be shared and posted. All right, next slide. So just to shed a little light regarding the corrective action plans or CAPs, providers will get a letter with the findings, including the tool and scorecard. With the first CAP or corrective action plan, we will allow the provider to correct the findings within 120 days or 4 months. We will meet with the provider to review and assist any way that we can. If the corrections have not been made and expectations have not been met within that 120 days, partnership will issue a second CAP outlining the corrections needed, and a meeting will be scheduled with that provider. Next slide, please. Okay, and here is a snip of the ECM tool and scorecard that you would be receiving. So you will see the specific ECM core components and key elements outlined, which include outreach, engagement, care planning, coordination, health promotion, transitional care, member and family support, coordination of referrals, and quality monitoring reporting. We are committed to support our providers to achieve these DHCS projected auditing parameters. And next slide. All right, and we will also be conducting scheduled site visits. So our team will schedule a site visit to meet with the provider, learn more about your CS and or ECM model, answer questions, and build our relationship even stronger so we can continue to work together towards our member goals. All right, and next slide. All right, and here are the key email boxes for support. And again, if you want to know if you have any other questions or if you want any more information, we do have an office hour coming up on December 10th from 12 to 10 that you can register for. So please do so. All right. And is there any questions? Yeah, Amber, I can, I think we can send these slides after this meeting. I just want to check with Eva though.
Yeah, these are will all be available in the drive, and we'll send them out in the post-session email.
All right, fantastic, thank you. Oh, and thank you so much for that office hour link. Okay, Tyler, what was your question about the TAR indicators?
Can you hear me all right?
Yes, I can, thank you.
Okay, wonderful. So the TAR indicator, thank you for that update, by the way, that's wonderful. But does it only show active TARs? So if a person closes out a TAR, will that be, is there any indication of that?
No, yeah, that's correct. So it is going to show the active TARs. Yep.
Okay. And then when someone closes out a TAR, how soon does that get removed off of there?
I believe it is being updated in real time because it coincides with our system, but I can take that back and just double check 100% for you.
Okay, thank you so much.
Yeah, of course, absolutely. All right. Well, again, thank you all for having me. And Eva, I can send it back to you.
Great. Thank you, Brittany. And we think we can go to the next slide. And I will pass it over to Gretchen.
Great, thank you. And Brittany, thank you for that great update. That was really helpful. So appreciate those slides. So we wanted to continue our conversation, which we started last month around our asset mapping. And we have taken a new approach for our ECM asset maps and taking in what we've heard from you in various conversations in our CPI meetings and taking the list of contracted providers from partnership. We've tried to create some maps that show which providers in aggregate we have for ECM services, and then in each county, which providers serve the various populations of focus. So if we can go to the next slide. So here's what the aggregate looks like in terms of the 5 counties that we have here and the different providers that are working in each county for ECM. If we want to go to the next slide, we can see the list of providers that we have compiled for each county. We'll just keep going through. We have many of these slides. I'll just keep going. Of course, Shasta has a lot of different providers here. We'll just keep going. And then we broke things out by county and by population of focus to really show which providers are serving which populations. So next slide here. So we're hoping that as we think about making referrals, as we think about, working on our coordination of care efforts and our implementation and management of ECM and community supports, that we'll start to narrow into this data a little bit more so that we can use this as we're trying to find providers to best meet the needs of the individuals we're working with. So let's keep scrolling through. Oh, you're already doing that. You're way ahead of me. Next slide, please. Yeah. And all of these will be in the slides. You can access all of these on your own time. And what we wanted to get to is to talk about, we have all this information, we have all this data, we have our provider registry. You all come to the CPIs, which is wonderful. So we wanted to kind of think about how do we use all of this information in a way that is going to be helpful to you in your work on ECM and community supports. So I'll start out with what is helpful about these maps and these lists of providers that we've broken out for ECM by population of focus.
Well, I know for me, what's nice about seeing it is it gives us a good sense of if people are moving to that area, like how we can transition care. And also just being mindful of like who our partners are in the area as well too. I don't know how others feel about it. Like if I was a new provider, it'd be really nice to know like who my subject matter experts were in the area.
Well, that's great. Thank you, Amber. Anybody else want to add to that? Or, what is not captured in these maps? What could we do to improve these maps to make them more useful as we, again, go into year 4, goodness, of ECM and CS?
I agree with Amber, actually. I think it's really helpful because we are not the experts in every population of focus. So it's nice to know that there are other people out there that are experts in those populations of focus, because if we're doing our care plan for somebody and we're checking all the boxes of things that we're good at, but if there's something that we're just not really effectively helping them on their goals for, we'll connect with other providers and make sure they get connected with the right person to finish off those goals.
That's great, Christina. Thank you. Anybody else have thoughts on what's helpful about these maps and these lists? Oh, and thank you, Melissa, for putting the links in the chat. What's missing from these maps, or what's not captured that we could think about adding in that would be helpful? Oh, Marcy, I see you have a great question. Is there a contact info there on that map? So currently there is not. Would that be helpful for folks? And we have our provider registry, which has some contact info, but would it be helpful to merge these?
Well,
I'm
I
seeing
did just click on the link that was provided in the chat, and when you go to that map, it actually brings up a phone number when you click on the highlighted the little location, the little yellow location. It does bring up a phone number. So
Yeah, and there is an ability to actually include additional details in some of these maps. So this was kind of a first pass to see how everyone reacts to it, determine whether this is something that you would like to use. But we can also tag some of these areas. So like one of them that I have up right now is the Shasta County Enhanced Care Management Providers. Those are only local providers that have a local footprint in the area. So if you're looking for a referral partner or someone like you guys had mentioned, that is providing a service that you're not equipped to provide, you could go in there. But there is an ability for us to provide additional details. So if you wanted to see the populations of focus for example, Hill Country Health and Wellness Center, and maybe even the provider referral coordinator lead, then we could put that information in there too. So just kind of curious to see what would be helpful.
So Partnerships Directory has their populations of focus on there right now. And so that's typically what I go to first if I'm looking for another provider that serves a population of focus that we don't serve. So I think it would be duplicative if you did that, but having contact information for people would be really nice, other than whatever the front desk line is at each of these provider offices.
feedback. So what are some of the ways, I know we've talked about going to look for expertise, and if you have clients who you think could use additional support that your organization's not able to provide, how else could we utilize these maps? How else do you think they could be useful in your work for ECM and community supports? Would it be helpful to create like a one-pager for each county that would list all the organizations? I guess we could put in some contact information as well. Would that be helpful to do?
Well, I think it'd be interesting to get feedback from the county, representatives from the county, because I think each of us are going to have different needs. I just had a meeting with some folks from Siskiyou County, and they were sharing that their ECM utilization was still up and going. So, I could see it might be helpful for them to know, but I think it's going to depend county to county would be my guess.
So Tyler, I saw you said yes. Which counties do you serve?
We serve Shasta.
Okay. What about folks? Oh, go ahead, Amanda.
I was going to say, and the map doesn't really kind of cover, because Connected Living, we have people on different sites, and so it only has us listed as being in Shasta County, but we actually have people up in Siskiyou and people down in Tehama, but that's not captured on these maps.
That's a great point. So that would be important to probably ensure that we capture all the sites where you're providing these services. So do we reach out to Amanda and say, tell us where you are?
You can.
Help us finesse these maps a bit more. Okay, good.
We do keep growing and keep putting people in new places, so.
And that's great. And I see that, Christina, you asked the same question. How do we capture your expansion efforts? Melissa, I don't know if you have thoughts on how we would go about doing that, if we're waiting for partnership to give us more updated contracted provider lists, if we would be reaching out to you all to tell us what's happening.
Yeah, so like I said, the first pass at this was to put in wherever there was a local footprint. So there may need to be a need for us to update some of the addresses. And if that is of interest, then we can definitely do that. Again, kind of wanted to present these as an option and see if there's interest in using them. I think some other alternate options too is this: if you have other staff who should know or would benefit from knowing where these services are, or want to be able to share that, then it's helpful to like bring them into these conversations too. But yeah, if we do want to go through and add in more locations, we can definitely do that. Right now they are kind of based on counties. So for example, if Dignity Health has multiple locations, we'll just have to kind of tag that a little bit differently. And I think there is a map that kind of reflects that, and I would need to find which one it is, but I think it was like one of the MODOC maps. There are some providers who are actually in Shasta, but they're able to provide services in other counties. And so that was reflected in one of the maps.
And Christina, do you have suggestions of how we could capture your expansion efforts? Or any changes to your contracts and who you're serving?
So typically, again, that kind of gets updated inside of the partnership directory. So I think that the hardest part to me on all this is, are they local people or are they some, you know, person out of Arizona who's providing these ECM services? Because that makes a huge difference on whether or not we're going to talk to the other providers, honestly. Like if you don't know the community that you're serving, then I don't think you're really effective at doing the ECM stuff. And I'm sorry if there's people on this call who feel differently, but it makes it really difficult when we're trying to find other providers. It may say on the directory that they serve Siskiyou, but for us, when we put somebody up in Siskiyou County, we are putting them up there and they're from that area and they know the resources out there. So it's harder to make sure that that's being captured if you're using the partnership directory, right? Because the partnership directory is not going to differentiate those two.
Yeah, Christina, just to kind of build on that. So these maps only show local providers, so they have to have an address locally within the county. If you look through some of the slides, it'll actually say that statewide providers are not on here, because I know we've heard from you guys that there's an interest to know who's there locally, that way you can refer to them directly. So that we did take that into account. Which kind of makes it hard, because if you're an organization that has an address in San Diego, but you can provide services in the Northeast, it's kind of hard to map them because it looks like they're not really there, right?
Right. And I think honestly, maybe the best way to get that information is communication through this group, but I don't know the right answer to that question, honestly. Like if you sent out a survey to all of us, I could tell you what contracts we have and what people we have locally sourced in the different counties and which ones we're about to expand to. But I don't know. It's something that would just be really difficult for you guys to keep on top of, for sure.
And like for us, it's kind of difficult because our main address is in Reading, but we do have people at addresses in the other counties. But you'll never get that address anywhere on partnership or anything like that.
We come back to you, Amanda. Amber, I know you wanted to jump in here too.
Well, I think I totally agree with what Christina said. Like I think for ECM to be successful, you need to know the community you're working with and serving in. I think that also like you have to know the population as well too. So telehealth isn't really going to work for people who are like deep in their substance use and their homelessness. Like, so the modality piece. So that's like my first, like just general thoughts. And then my second one is, I guess, kind of protection from you guys is I don't want to create a tool that no one's really quite sure how they're going to use, or that it's similar, although I love it. So I want to be really clear. I'm a fan. I'm team asset mapping. And like, since partnership has some of this stuff on the website, I want to think how this could be a complementary tool and really be used for folks, because it is a big lift what you guys have done. And I just want to make sure that it's not just like a work product lift, but that we can really actualize it.
Those are all really good points.
Maybe it's a matter of getting the contact, like the local contacts for each of the area, because that's one thing that we've all talked about so far, right? Is it would be nice to have somebody who we can contact that are inside of those areas. So more of a directory of people who are in those areas more than the companies that are inside of those areas. And that would have to come through this group. It wouldn't necessarily be duplicative of what partnership is doing, because partnership has the counties listed on there, but not necessarily the people to contact. So maybe that's the answer of what would be most useful.
Great suggestion. Anybody else have thoughts? So what are some next steps that we should think about? So I'm very mindful, Amber, what you said, we want to make sure this is actually useful before we invest a whole lot more in it. So what do you think would be some next steps that we could consider to make these useful for you? Is that contacting Amanda and Christina to find out who are your point people in each of the locations that you're working in and putting that together? Is that adding in some of the statewide providers as well? I just would like to get a sense of where folks are.
I like the focus on let's start with contact information. And I do agree, Amanda's right. Like it's going to be a little creative for all of us, but maybe that's some ownership we can take of like the most central way for people and we can share that. But I think that could be a good place to start.
Great. Anyone else want to jump in here? Partnership, I invite you to weigh in too. I know you work in many counties and don't know if there have been some similar efforts that have been successful that you might want to share here as best practice.
Yeah, no, I think obviously all of these suggestions are could be extremely useful. I wish there was a way to actually indicate individuals based on providers. There's just so many staff turnover and whatnot, so I don't know how accurate that list would be, but I think potentially utilizing this group to get those contacts might be more efficient, but I'm just trying to kind of hear it out from all sides.
No, appreciate that. And Christina, I see that you're anything from the RTF where it says who the CMs are that are assigned. Do you want to talk about that more, Christina?
Oh, I was just wondering if there's one big data pool that partnership could do, because it'll say inside of the RTF who the case managers are, the lead care managers are for each of the people assigned, and it will give their phone numbers that are right next to it as well. So it could be a good way to pull that information of contact information. And if there is a way to do that where they can just pull that information, that could be something that can be distributed out monthly as far as who the lead care managers are and how to contact people about not necessarily direct participants, but inside the counties that are in that area.
So we can
Yeah,
have for dignity on the lead care. Oh, go ahead. I'm sorry.
Oh, no, it's okay. I was just going to weigh in there. I think that's a great idea as far as the LCMs that are assigned to specific members. There are some providers that really utilize those RTFs and make sure that those LCMs are accurate. There's also some providers that don't indicate LCMs. It's more, the staff that's doing reporting. But again, I think that's something I can definitely take back and see if we can, come up with or help facilitate some kind of a solution. Absolutely.
That'd be great, Brittany. Thank you.
This is like a totally out of left field thing, so I apologize. But something that could be helpful that we've run into is so sometimes our folks will get like they'll be assigned to us, we'll be working with them. It's time for the TAR to be like redone. I'm not thinking of the right word right now. I apologize. And then in the middle of that, someone else will kind of send in their ECM tar. And so it bumps out our tar and or whoever's tar. And the patient doesn't always understand, like they thought they were signing up for something different, or there's some confusion. And we have to call and like coordinate like who's going to be on first. And that's sometimes that's hard to find, like if you're talking about like what could be helpful. But if I knew, like I always call Amanda about this issue, or, you know, for referrals, like it's always Christina. Like I think sometimes those things can be really helpful as well. Like more the day-to-day operation stuff. Like if you want to refer someone to us, if you have like a referral you need to have like processed quicker, if there's some coordination that we need to do. I think those are the things that maybe the asset map could be a little bit more, it would be different from what partnership shares.
Amber, does your team have like a team phone number, like a department phone number for ECM?
We don't. We have something internal, like, so if people are trying to like send us referrals internally, we did set up like a general message box that can kind of bounce from person to person, but I don't know that it's ever been really like landed well.
Gotcha. I was just curious if there was a good way, like for us, we have an ECM phone line, and that's not what's going to be listed on the directory at Partnership, because the directory at Partnership has Dignity Health Connected Living's phone number, not our ECM phone number. So that's something that also makes it a little bit easier to contact us. We also have a ECM email address for all of our ECM team as well. That is not going to be listed on Partnership's directory, but is another way to contact my team. While also avoiding the trying to contact one individual person. So we have those things already set up here, but I also know some of these smaller places aren't going to necessarily have that. And also with Amber, I mean, you guys have had that team for a long time, but I know I used to work at Shasta Community, so I know that there's a lot of internal systems versus what's external facing as well.
Yeah.
Amanda, what do you guys do in terms of, do you have an ECM email and phone number? Or how do you run it with your different locations?
I'm with Chris.
You what?
I'm with Chris. I'm the supervisor.
Oh, I'm sorry. I'm not connecting dots today. Feel like it's Monday, but it's actually Tuesday. Forgive me. Okay, so I know the answer to that. Anybody else want to share how they run their their communications?
Thank you for testing her though, Gretchen. I want to make sure she gave the same answer as me.
Oh, okay. So I'm glad to be
just kidding.
Ignorance here. Anybody else? Did you guys set up different systems for ECM or community supports? All right. Any other thoughts on this before we move on? I want to make sure we capture people's, even the left field ideas that Amber brought in were great. So if anybody else has some way out there, we'd love to hear them too, so we can think about it and work together on them. All right. If nothing more, I'm going to turn over to Melissa.
Thank you. We can go to the next slide. Okay, so we have been working on a couple of resources on the back end, and I can't take any credit for this. This is all Eva. I'm just speaking to it. But just wanted to spend a couple of minutes, and maybe we can click and open on each of these resources, or maybe we can get them in the chat. Wanted to see if we can get some feedback on these regarding like what specific information you would like to see in the resources. Are there any related resources that would be more helpful, or have you used or seen something similar? Some of these, so like the Q&A document, are just frequently asked questions, and we pull those from the sessions as well as what we hear from other collaboratives and things like that, and try to give you updated responses. And then we have a JI population of focus and birth equity population of focus one-sheeters that are intended to either support your case managers in talking about both of those populations of focus. I know this is fairly new for a couple of providers, and so as you are providing these services, just kind of identifying what would be helpful in terms of having a one pager and translating that either into talking points for you or just a quick resource that you can lean into. And it might be, you know, if you're doing some 101 with new staff or things like that, kind of considering what should be included there. So maybe we can start with the birth equity population of focus one pager and get a little bit of feedback from you guys in terms of ideally, if you had a one sheeter, what would be included on it? And Eva, I don't know if you want to like voice over some of what you included.
Yeah, I think I was just starting really basic because I really wanted to get your perspective on like what you need to have in this resource. So it's just started with eligibility, how members would access these services. I think there's something about the MOUs at the bottom. But anything else that you would really want to have like readily available at your fingertips related to birth equity, and then also JI, Justice Involved, is the other one that we're working on right now. Because we know like we have access to the resources that are much longer and much more in depth, but something that is simple and that you could maybe share with your team. And that really pulls out the most salient things that you would want to have access to.
Is anybody working with the birth equity population of focus? Maybe that's a starting point. No?
We aren't doing the birth equity one, but we are working with individuals who are pregnant. But I love the one pagers. I think they're great for like new staff that are coming on board. And one of the things that always gets kind of confusing for my team on the children's side is like, you know, when we work with kids, you're really working with a parent, but like, who do you enroll if both the parent could probably use ECM and the child could use ECM? So I think any sort of one pagers around that are great.
Just to confirm, is that more around children and youth population of focus? Okay. So maybe it's like, this is the birth equity one, but there's also the children and youth one. Okay. Maybe we can go to justice involved. So Eva, I don't know if you want to cover this one.
Yeah, sorry, I have to make it a little bigger. So yeah, again, just like basic background information, what the Justice Involved initiative provides. Again, eligibility criteria for pre-release services. What those services include. Yeah, and I guess that's it for right now. But again, like if there's anything else that you would really want, information that you'd want to have readily available pertaining to this population of focus, what would that be? Or if there are also any resources maybe that you have accessed that have been helpful. Curious what those look like.
I have a question. If we made this community facing, so if you're working with the JI population of focus and you wanted them to know what services or what they may be eligible for, how could we kind of make it so it's for that? If you don't find a use for it for yourself internally, right? But if you want to disseminate a one pager and maybe have a section to have your contact information or something like that, kind of understanding like, is that first half necessary if you're going to just share this with a community member? Or would you focus on like the eligibility criteria? Here's the types of services that could be included, and then here's some contact information. And then you guys could use this to share out with that population of focus. And I guess same thing for birth equity, like would that be helpful?
I think it's helpful because I think a lot of people don't know that it wasn't a thing before. I don't know how many people like know much, so just to kind of, these are new populations that we're working with. And so I think it's a nice intro to kind of set the stage personally.
Anyone else? Maybe I'll call on people. Tracy, Marcy, Sarah.
I'll jump in on it. So we work a lot with justice involved people, but I'm curious on this. This is covering that people will be able to get access to Medi-Cal and assuming partnership if they're within the area while they're at the end of their or the 90 days before release, right? Or within that time frame. So with a one pager like this, like who is this going out to, right? Because we're not going into the prisons or jails to inform people of this. So I'm wondering who this information is for, just so we know that they have access to Medi-Cal, or is this getting distributed to the people incarcerated? I'm just confused.
Yeah, so this one is intended for the providers. So if you're a provider who is providing JI services, then this would be intended for you. But my other question was, does it make sense for us to create a version that is more community focused? And so it may not include like the pre-release information because unless we send this to the correctional facilities, right? But the correctional facility is not going to give this to the individual that's incarcerated. So right now, the way that this is outlined is that it's more for the provider and not the individual. But if we think that there's a benefit in creating something for the individuals, then we would revise the language here.
Yeah, and I'm just curious, like what that transition would look like too. So I guess if if that was included on the one pager for providers of what the transition from someone who is incarcerated and then obtains Medi-Cal and then wants to go out on something like community support, short-term post-hospitalization or something, like what that transition would look like and how we would facilitate that.
Yeah, I think that would be the post-release. So we would provide the post-release information because then that's something that the individual could have more access to. I wouldn't include the pre-release. So this one right now focuses on pre-release. It's not inclusive of post-release. And welcome anyone else to jump in and clarify if that was clear as mud. Eva, I know we have only a couple minutes. So I don't know if we want to transition into something else and kind of take some of the feedback into consideration.
Yeah, I think we can move on. I think this was helpful in kind of thinking about different versions of these resources and making some edits. We can come back, and also if anyone is interested in providing more feedback, we can circle back with you as well. But thank you for those thoughts. Next slide, please. Next slide. I don't think we have any of our test users on the call, but just a reminder that these ECM and community supports guides are available on the in the drive. So you have this resource available to you, which is an easy to digest fact sheet that can be printed or saved and used by your staff to clarify ECM and community supports and for folks who might be eligible for these services. Next slide, please. So our first poll, we have a couple coming up. The first one is just what section of today's session was most valuable? Was it updates and resources, the MCP updates, or the ECM asset map discussion? So I'll just give everyone a minute to fill that out. All right, I think we can go ahead and end that and we can share the results. Okay, so it looks like updates and resources. Okay, that's super helpful. Thank you everyone for providing your feedback. We can go to the next slide. So we would love to increase our office hours engagement. Lately, only kind of a few folks have been showing up, and we really want to understand how we could make this most helpful to you all. Whether it is helpful to do office hours directly after a session and sort of do like an informal Q&A format, or if it would be good for you all to schedule them separately and have a dedicated topic that we plan to discuss during those office hours. So we'd love to hear your feedback about what is most helpful. All right, yeah, and it looks like maybe a separately scheduled office hours with a dedicated topic would be helpful. And we can go ahead and close that out and share. Great, thank you for that feedback. We can go on to the next slide. So just a reminder to, continue implementing your improvement practices. Our December session will take place on December 17th at 1:30 p.m. A registration link will be sent out in the post-session email. On November 25th, we're going to have a CalAIM 101 Learning Lab. The topic is going to be ECM and Community Supports 101. And a calendar invite and registration link will be sent out after the session as well. Next slide, please. And again, we're always available for one-on-ones. If you would like to discuss an overview of Medi-Cal transformation, an overview of what we've done in the Northeast CPI so far, strategies to engage with your MCP or anything else that we can provide support with, please always feel free to reach out to me. My email is listed there. And office hours are also a great opportunity to get additional support with any of the items that are listed here. Next slide, please. And thank you everyone so much for joining. Thank you for your engagement. Hope you have a great rest of your week, and we look forward to seeing you soon.